Hey guys, Dr. Gary here. Let's talk about the lip lift healing process. A lot of people ask me, since I do a lot of these surgeries, what is it like to recover from a lip lift? So let's kind of talk through the different stages, because it's not like so easy to say, okay, you're just gonna have a 1 week downtime. What does that even mean? Let's kind of break it down. So when we're done with the surgery, you leave the office with a bandage, kind of a skin colored bandage, not too noticeable, you know, just kind of a bandage on the upper lip. Most people these days, at least in 2021, are still walking out of the office with a mask on, so it kind of covers that up. You leave that on for 24 hours. You'll remove the bandage after 24 hours. At that point, you can shower, you can let the water run over the area. The key is not to rub the area where we worked, and you can just put antibiotic ointment on 2 to 3 times a day. The first evening is when some patients experience some pain, some discomfort, upwards of maybe 6 to 7 out of 10, and that's when patients will usually take a narcotic medication that I prescribe, Percocet, 1 or 2 pills the first night. Some people don't take any narcotics, and that's fine too. You can take plain Tylenol. You want to avoid like Motrin, Advil, ibuprofen, because that can thin the blood and have you ooze a little bit more. 24 hours, remove the bandage, shower, apply the antibiotic ointment. You're going to have some swelling. The worst of the swelling is at day 3, and then it starts to get better. So just anticipate a lot of swelling. I give a Medrol dose pack, which is a steroid, to try to mitigate that swelling, but ultimately, you know, it'll still swell. Whether you put ice on or not, you're still going to get swelling. By about a week's time, when you come see me in the office for the suture removal, 5 to 7 days for suture removal, most of the swelling will be gone. I mean, I would say about 85–90% of it. And then the remainder of swelling is going to take many weeks to completely subside, about 12 weeks. So with each of those passing weeks, maybe another 2% points will get, you know, reduced further along as you go, week by week. So by the end of 3 months, really all of the swelling has gone away. Bruising is possible in the first, 2 weeks. Some people bruise, some people don't bruise. Some ask me, should I take like arnica? You can. I mean, the data in our literature is kind of equivocal on whether arnica really helps for bruising, but you know, some people choose to take the arnica pills, and that's okay. That's kind of like the first few weeks, and then what happens next is we take the sutures out 5 to 7 days. The area is going to be, you know, a little bit raw looking. You're going to keep applying that ointment, and then at around day 12 after surgery, you can test the area, the incision line, with hydrogen peroxide. If it fizzes, like that little white kind of fizzing, that means you should continue with the ointment. If it no longer fizzes, you switch to something called scar gel. I recommend biocornium in my practice. Patients usually get it from our practice since it's sold mainly through doctors' offices, or you can do something over the counter like Mederma. I always caution patients on Mederma or other over the counter scar gels because they have extra additives in there, and some people are hypersensitive, like their skin is just very sensitive to some of those additives, and you can get some increased itching and redness to the area. So I prefer something more pure like biocornium that also has SPF, sunscreen protection, built in. So you start the scar gel at around day 12 when you pass that hydrogen peroxide test, and you keep going with scar gel for the first 3 months. Once you start that scar gel, you can then put makeup or cover up on top. So that's the first time you'll be able to start really covering it up. And by that time, again, at the end of the second week is when like most of the swelling and bruising has gone down, and now you're able to put on scar gel and makeup, and that's when you're really more presentable to the public, to your friends and family. So it's about the end of that second week. But remember, the incision is going to stay pinkish and reddish for many months in most cases. So just keep that in mind. It's going to be a while until that fades. Usually it takes about 3–4 months for most of the redness to go down. And then I tell people that the incision will continue to transform and heal over the course of the entire first year. So just have to be somewhat patient with that process. It's surgery and surgical recovery. It takes time. So fully presentable, I would say at 2 weeks, 3 months, things are really, really much better. And then a year for like that final result of your scarring. And then at the 3-month mark is when I kind of judge things in terms of the healing and advise on whether or not we should do some steroid injections, whether or not laser resurfacing might be helpful, or sometimes a little scar revision, whether it's on one portion of the scar or across the entire scar, which in my practice would be very rare. But that's like the earliest time point when I would consider something like that. So that's pretty much the recovery process. In terms of things not to do or to do after surgery, I tell people to be on a soft food diet for 2 weeks to really limit the facial expressions and the amount of mouth movement in those first few weeks after surgery. That's really critical.
Amanda?
And And anytime someone asks about like dental work after a lip lift, I tell them to wait about a month, because there's some manipulation of that upper lip, and trying to kind of reduce that is really helpful. The other thing I'll say is in terms of the tightness that people feel. There's always going to be some tightness for usually the first few months, and the reason is because there are deep stitches that are placed, and those deep stitches are helping kind of keep everything together and are trying to optimize the appearance of your scar. So we want that tightness. That's not a bad thing, but I know it bothers people and they feel like they can't fully smile. What I find is that at about the 2-month mark, at least in my practice with the type of sutures that I use, the area starts to relax, and then by the 3rd month, or at the end of the 3rd month, most people are kind of able to express and smile normally and really aren't hindered by those deep sutures anymore. So again, we always just tell people, please be patient with that part of it, but I've never seen any permanently altered smiles or anything like that from the tightness. It always relaxes over time. So hopefully you guys found that useful on the healing process after an upper lip lift. If you guys haven't seen my work, please check it out. The best place to go to look at all the results, I know it's a little old school, but on my website, the gallery, a lot of people just go to, you know, Instagram, Real Self, sometimes YouTube, but make sure to go on the actual gallery, the lip lift gallery on our website, City Facial Plastics, to really see all of the work as you're trying to make a decision whether, you know, the surgery is right for you. And then ultimately, of course, you got a call, scheduled consultation, so I can tell you based on your anatomy, based on your goals, if this is something that could work. All right, guys, Dr. Gary checking out. Make sure if this was useful to like the video and subscribe to the channel. Thank you.